everybody, Shawn with the Tactical Medic. We just got in something that I thought was kind of cool, and I thought I would share with you guys. A company called Eldon makes a blood typing kit, and these are sold to clinics and medical personnel and whatnot so that they can do a quick and easy blood typing on somebody in the field, because as I understand it, it's kind of important that you get the same type of blood that is your blood unless you're using the universal donor blood. So we got these guys in, and I went ahead and we packaged them up into a little bit of a 3-pack here. It's got 3 of these kits in it: a Pause antimicrobial wipe 2-pack, some extra alcohol wipes, and a pair of gloves, so that if you are in the field, or you're a prepper or something like that, and you're trying to determine a patient's blood type, and you need to find a donor, you've got a couple extra ones here, and the stuff to deal with bloodborne whatchamacallits. So I went ahead and did one of these kits, and the results were a little interesting. So I'm going to do another one here just to verify the results. The Army told me that I am B positive, and that is what is on my records and my dog tags. I've never really had it checked otherwise due to my participation in the Persian Gulf War. I was told that my blood is no longer welcome at blood collection points, something about the anthrax virus. But I figured go ahead and do this. So first thing you do is you open up the kit, you take out the contents, and verify that you have all of the correct contents. What you should have is the outer bag, which you're going to want to put your everything in when you're done, because we are dealing with blood. You've got the instruction sheet, which is lots of pictures and whatnot, so you don't have to be any kind of a lab technician to be able to figure this thing out. You have the actual litmus card here with the agents and whatnots in a little sealed foil pouch. You have a piece of laminate so that when you do the test, you can seal the results. In case if you're a clinic or something and you're putting this in somebody's medical file, so you don't have ucky old blood around. There's a alcohol wipe, a little auto sticker thing here, a little pipette for water, and I've got a little thing of water here, and you have 3 of these little plastic sticks that you're supposed to collect the blood drop on and then rub onto the little circle. So I'm going to go ahead and according to the instructions here, step 1. The other thing you're going to need is a pen, because you're supposed to fill out the card with the patient's information. So it says go ahead and open the little foil packet. I'll go ahead and do that. Take the card out. The card has these little dried chemicals on them, and places where you put in the person's name, address, birth date. They sign it to verify that it's actually theirs, and you would write the actual blood type down here and the date that you did the test. You've got your lot number on the test, and the use by date. So step 1 is you're supposed to fill it out with your name, so I'm going to go ahead and put my name, and that. This is 7/6/15. All right. I'm going to go ahead and put that on top of. Actually, I think I'm going to put a card on top of the plastic here, and I'll use a little foil pouch to collect up all of my yuckies when I'm done with them here. Also, since I'm doing this on myself, I'm going to be stabbing myself here in the hand. So I'm going to go ahead and get these guys out and oops, get them handy before we start. Alright, and step one, it says to take this little thing of fill with water and to put a drop to each one of the chemicals. Alright, there's that. The next thing you're supposed to do is remove the little safety plug from this little doohickey and take your alcohol wipe. I'm going to make sure, since like I said, I'm doing this to myself, I'm going to do my non-dominant hand and clean the area. So I'm going to give myself cooties and take this thing and you stick it on yourself. Get a little cut on there. So you should put your hand down, kind of let gravity do some of the work here. You're supposed to get a nice little drop of blood going. They say up to about 1/8 of an inch size drop, which looks pretty close. And somehow you're supposed to, on the end of this little stick, blood on there, and this plastic doesn't seem to want to take my little offering of blood. God bless it. Okay, and take that and get it into the little dot, and you're supposed to spread it around. Give it a little stir. Water and whatnot, staying within the little circle. Okay. Like I said, I'm going to put these little guys in there when I'm done. And got my next little blood here. Alright. Pick that around. Okay. 2 down, 2 to go. I think I'm gonna get extra blood off. Squeeze out some more of the good stuff here. If you're like a scientist, look at me. Not the most exciting video I've put out, but well, what do you want? They're free. Get rid of the stuff here. Spread around the blood in there. All right, and the last one is the control. Oops. Well, I've got good clotting platelets, so that kind of is a little rough. I was hoping not to have to poke myself. This thing looks like a one-trick pony. Yep. So, they're good. There we go. There's that last bit of hemoglobin-y goodness. Okay. You're supposed to stir that blood around down there for a few seconds. And then you are supposed to move it around for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So there's that, and there's the card. Let me clean up all of my potentially infectious waste here. Swab, put all that potential nastiness in there. All right, so I've done the stuff, and the back of the card tells you how to figure out what's what. So, you got your different little things here. It's just kind of a monkey see, monkey do. And it looks like the Army was right. I am, in fact, B positive. So, hooray me. It says you're supposed to let this dry. And like I said, it comes with a little, basically a big piece of tape that you would put over the card to seal your results. And like I said, if that was, you know, if you're a clinic or something like that where you're maintaining this for somebody's files, you would have it available. And last thing would be just to put my blood type on there. I don't think I have the patience to let this completely dry for the purpose of this video before I put the thing over it, but there you go. Relatively painless, fairly easy to do. Like I said, you know, you just use the packaging to collect up all what's left over of your samples. If you are at a clinic and you've done a bunch of these, you would probably put them in with the rest of your biological waste disposal. But there you go. So I know that was kind of like watching paint dry, or actually in this case watching blood dry. But I'm Shawn with the Tactical Medic, and thanks for tuning in. Hopefully we'll have some other exciting things to show you in the days to come. All right, thanks everybody. Be safe out there.